শুভেচ্ছা দর্শক, আমন্ত্রণ জানাচ্ছি চ্যানেল 24 এর নিয়মিত আয়োজন প্ল্যানেটারি হেলথ একাডেমিয়া সুরক্ষায় প্রতিদিন অনুষ্ঠানে। দর্শক, ক্যান্সার যখন হয় কারো, তখন তার নানাবিধ চিকিৎসার প্রসঙ্গ আসে। সবচেয়ে বেশি যেই দুটো শব্দ আমরা শুনি সেটি হচ্ছে রেডিয়েশন থেরাপি এবং কেমোথেরাপি। আমরা রেডিয়েশন থেরাপির বলতে কি বুঝি এবং এই থেরাপি কাদেরকে দেয়া হয়, কিভাবে দেয়া হয় এবং তার সাফল্য কিসের উপরে নির্ভর করে, কতখানি সফল হয়, এই সব বিষয়ে আজকে আমরা কথা বলবো। আমাদের আজকের আলোচ্য বিষয় ক্যান্সার চিকিৎসায় রেডিয়েশন থেরাপি, অ্যাপ্লিকেশন অফ রেডিয়েশন থেরাপি ইন ক্যান্সার। আমরা এই বিষয়ে কথা বলার জন্য সিঙ্গাপুর থেকে আগত একজন বিশেষজ্ঞকে আপনাদের সামনে উপস্থিত করছি। আমাদের সাথে আছেন ডক্টর মাইকেল ওয়াং। হি ইজ চেয়ারম্যান অ্যান্ড সিনিয়র কনসালটেন্ট, ডিভিশন অফ রেডিয়েশন অনকোলজি, ন্যাশনাল ক্যান্সার সেন্টার, সিঙ্গাপুর। Dr. Michael Wang, welcome to our program.
Thank you for having me on the show.
It's a really great pleasure to get you among us and to learn from you. With the very first question will be, as I said in my introduction, that when we think about the treatment of cancers, generally two terms come in our mind: radiation therapy and chemotherapy. What is radiation therapy, and when we decide to go for radiation therapy for cancer patients?
Right. Radiation therapy is actually a localized form of treatment. It treats cancers directly, as well as regions around the primary cancer that is at risk of cancer spread. As compared to chemotherapy, chemotherapy is what we call a systemic therapy. Okay. It can either be given in the intravenous form, meaning injecting drugs into the vein, which circulates around the whole body, or given in the oral form. So this targets cancers that may have spread to other parts of the body. Okay. Sometimes it may not be seen, and sometimes in situations where disease has actually spread, stage 4 disease, chemotherapy is also used to treat cancers, just to control as well as to prevent further spread.
Okay.
So radiation therapy involves the use of very high energy X-rays.
Okay.
If I can describe what X-rays are, they are actually electromagnetic waves that do not carry any charge. Imagine going for a chest X-ray. Going for radiation therapy involves giving X-rays many times higher than the energy of a chest X-ray. Okay. This X-ray will pass through the body. When it enters the body, it enters at a very high dose. And when it passes through the body, it goes out of the body at a lower dose. So we can actually target cancers using high energy X-rays, but the downside is that normal tissues before, after the cancer, and around the cancer may be exposed to some dose of radiation. Okay. So in terms of what we have currently, in terms of technology, we have technology to increase doses to cancers with X-ray treatment, as well as to reduce the dose of radiation to normal tissues surrounding the cancer.
Okay. Thank you so much, Dr. Michael Wang. I will very briefly translate what you said for our Bengali audience. দর্শক, ডক্টর মাইকেল ওয়াং যেটা বললেন যে ক্যান্সার চিকিৎসায় আমরা যখন সিদ্ধান্ত নিতে যাই কোন ধরনের চিকিৎসার মধ্যে দিয়ে যাব, তার মধ্যে কেমোথেরাপি যেটা, সেটি সাধারণত আমাদের ইনজেকশন হিসেবে দেওয়া হয় অথবা আমরা খেতে পারি, কিন্তু সেটি আসলে আমাদের সারা শরীরের সব জায়গাতেই ছড়িয়ে যায়। আর রেডিয়েশন থেরাপি যেটি তিনি যেটা বললেন যে খুব উচ্চ শক্তির এক্সরে, সেটি আমাদের একদম ক্যান্সার যেখানে হয়েছে ঠিক সেই জায়গাটিতেই সাধারণত আমরা প্রয়োগ করি এবং তার মাধ্যমে ক্যান্সার সেলগুলো যারা আছে, যে ক্যান্সারের কোষগুলো আছে, সেগুলোকে ধ্বংস করার চেষ্টা করি। ডক্টর Michael Wang, thank you for giving the introduction. So when we think about radiation therapy, as you mentioned that it's a high energy X-ray that enters in our body, there are also developments that we have seen from the classical radiotherapy to what we apply today.
Yes.
Can you also give us that kind of the journey that we have gone so far regarding this development in radiation therapy for cancer treatment?
So as you know, for radiation, it's actually been used to treat many forms of cancer. We use it in various settings. For example, we use it in the preoperative setting to reduce the size of cancers, so that when patient goes for surgery, there is an increased chance of fully removing the cancer itself. Okay. Radiation is also given in the post-operative setting to reduce the chance of the disease coming back in the local area. And of course, there are certain cancers which are only treated with radiation. For example, prostate cancer, and I think in also some head and neck cancers like nasopharyngeal cancers. And in the last setting, which is actually the most common use of radiation, it is used to treat patients in a palliative setting, stage 4 cancer, where the cancer has actually spread to certain organs in the body, causing pain or bleeding or even blockage of organs and things like that. So radiation is actually used for pain relief also, and it's also used to stop bleeding. So talking about radiation itself, there are many...
the development that we have found in this technology.
So there are many forms of radiation.
Yeah.
Okay. Radiation has been in use for over 100 years. And I think in the initial journey, essentially, most of the time, X-rays are being used to treat. So in the past 100 years ago, the X-rays are actually of very low energy, so they cannot penetrate through the skin too much.
Yeah.
You know, actually, and the early sources are all all natural sources. That means a radioactive source is found, and it's just held in front of a patient to treat tumors. So all physicians handling or doctors handling the radioactive source will be exposed to radiation too. Yeah. So subsequently, high energy X-rays are actually man-made, you know, and we progress from higher energies to actually very high energies which can penetrate through the skin. So that is the main form of radiation treatment in many countries around the world, you know. And I think with more physics knowledge and things like that, many other atomic particles have actually been used to treat cancers, you know. But just looking at the physical properties, you know, each particle has got a different property. So, for example, we have proton therapy, you know, which is an up-and-coming technology. Proton therapy is actually a subatomic particle. It's actually a hydrogen atom with a positive charge. And the characteristic of this is that it actually passes and enters and passes through the body at a very low energy, and at a certain depth within the body, which is where the cancer is situated, we can program it to stop where it releases all its energy to kill cancer cells. So beyond the cancer and around the cancer, you have actually no or very little radiation dose. So that's the physical sort of attractiveness of proton therapy. We also have other heavier particles such as carbon ion and things like that, but their physical nature is a little bit different, and it's largely due to the size of these particles as well. So on the other hand, we also have, on the other hand of the spectrum, we also have a negatively charged particle, which is known as the electron. Electrons are used to treat mainly very superficial tumors. For example, cancers of the skin and cancers in the rib cage and things like that. So these are very superficial cancers. And the good thing about it is that the penetration is not deep, and deep-seated cancers or deep-seated normal tissues are not affected by these particles. So there is a whole array of ammunition which we can use to treat patients. But the most important is to make sure patients are treated safely and without any side effects from all these treatments.
Thank you so much. It's really nice to get that snapshot of all the ammunitions that we have in our hand, like from positively charged proton to negatively charged electron. Everything is now being utilized for the treatment of cancers under this umbrella of radiation therapy. So regarding these, the different type of cancers that you have discussed so far, for example, the cancers on the surface can be treated with electron therapy, but the cancers deep inside the body will need a different kind of radiation.
That's right.
So is there any cancer for which, you mentioned about prostate cancer, but what type of cancers can be treated only by applying radiation therapy? We don't have to go for other options. Is it also a stage specific? For example, the cancer, the first stage probably can be treated more successfully with radiation therapy compared to later stage cancers. Is it the case?
Right, okay. So I think that is a very interesting question. So, I mean, prostate cancer is my it is my specialty.
Okay.
So most cancers, for most cancers, there are various modalities of treatment.
Yeah.
So to talk about prostate cancer, there are two main modalities of treatment. One, of course, is surgery, and the other one is radiation. So both of them will actually give you the same chance of cure. However, if you look at the different groups of patients, going for surgery will mean removing the entire prostate. Some patients are not too keen for that.
Okay.
And I think in certain stages of the cancer itself, sometimes going for surgery may not be able to completely remove these cancers, especially if it's gone into the surrounding. So for prostate cancer, essentially these two modalities of treatment exist because the cure rates are relatively similar. At the end of 5 years or even 10 years, you find the same proportion of patients being able to live up to that age. So talking about radiation, for radiation there are many modalities which we can use to treat prostate cancer. So there's more than one. You can use X-ray therapy, you can even use your proton therapy, and you can also use what we call, which I didn't describe just now, brachytherapy.
Okay.
Yeah. Brachytherapy means we actually bring the radiation sources right into the cancer itself. And because these radiation sources actually gives rise to radiation within a short distance outside the source. So it can also be used to spare some of the surrounding structures. But this treatment actually involves some minor surgical procedure as well. And it has to be done in a specialized center.
Okay.
So regardless of the modality, if you look at the long-term outcomes, it's fairly similar to that of surgery. It is another method of treatment for some of these cancers.
Okay.
Other cancers
does it mean that before we go further, we can consider radiation therapy as an alternative to surgery for some cancers, for some patients?
That's right. I probably would not say it's an alternative.
Okay.
It's another option of
another
treatment.
option.
That's
Yes.
right. Yeah. So
another option.
So at the National Cancer Centre Singapore, I think most patients who are newly diagnosed to have prostate cancer, they would have had discussions or meetings with the urologist and the radiation oncologist. And I think most of the time, we leave the decision of treatment to the patient.
Okay. Yeah. That's great.
Right. There are certain cancers which cannot be treated with surgery. I mean, in the Asian setting, we actually find some patients with nasopharyngeal cancers, which is at the back of the nose. So surgery is difficult for patients in this area. So in patients with very early nasopharyngeal cancers, these patients are actually treated with radiation.
Okay.
Yeah, the more advanced ones will be treated with radiation in combination with chemotherapy.
Chemotherapy, that's right. Dr. Michael Wang, when we give the options to the patients, or when just we discuss about the options, radiation, the word itself sometimes can be a bit, what do you call it, fearsome. It may induce some fear to the patients. What are the general side effects of radiation therapy, and is it comparable with other therapeutical options that we have for cancer patients, and how you try to minimize the side effects of radiation therapy for the cancer patients?
Okay, so I think you're right in every sense. Even in Singapore these days, the word radiation spells a lot of fear for patients.
Yeah.
I think a lot of it actually comes from the historical use and the most common use of radiation. So as I mentioned just now, radiation has been used quite commonly for palliative care.
Yeah.
So I think in patients of this category, radiation is used to relieve pain, stop bleeding, or any form of discomfort. And as you know, for such patients, I think the lifespan is not very short. It's not very long, sorry. And after the end of radiation, I think most patients may pass away. And there is always this association linking radiation with death. Yes, that's right. Yeah. So I would say it is hard to change that, because such patients will be mostly in discomfort. And sometimes radiation, although it doesn't add or it may reduce the discomfort. It doesn't change the general picture for caregivers or even friends of all these patients. So radiation itself does come with some side effects. So I always tell patients, going for radiation is like going for a daily sunburn over the period of time. So radiation causes two main side effects, two main classes of side effects. One, you have the early side effects, which happens during treatment or soon after treatment. And the other category is the late long-term side effects, which actually comes 2, 3, 4, 5, 6 years later. So many a time, most radiation oncologists will pay a lot of attention to the long-term side effects. The early side effects is actually due to radiation effects on tissues that reproduce very quickly. So, for example, if I look at the skin or your mouth cavity or even your intestines, so the lifespan of these cells is actually quite short, meaning every few days or 1 to 2 weeks, they will die off and then another new cell will come out. Okay, so radiation does affect these cells quite significantly. Okay. So, for example, if I were to treat the mouth, which is, I think it's quite a common, you get very common cancers. Yeah, that's right. So the entire mouth area will be treated. So first, the skin will be affected, and then the tongue will be affected, and your cheek will be affected. Okay. So this is just like going for a sunburn. So in the first 2 weeks, you will not see anything, and then after about 2 to 3 weeks, the cells of the skin and the tongue and the mouth will slowly start to die off. And then when it starts to die off, you can see that they will start to turn a bit red, inflamed, very painful, and this is when you see the side effects. So, but there are certain organs which are not short-lived. I mean, they have a long lifespan of months or even years. For example, the spinal cord, certain bone tissues and all that. So you will not see side effects in these organs at the early stage. So it depends on the cancer and the area where we treat. If we treat a lot of intestines, patients will get intestines that become red and inflamed. So they get diarrhea, pain, just like in food poisoning. Okay. Yeah. So just like the skin, all these side effects, for example, if I give a patient a 5-week course of treatment, I will give treatment on a daily basis, usually 5 days a week, and we rest on Saturdays and Sundays. This is actually to let the normal tissue recover. Okay. Yeah. So over time, the damage is accumulated. So in the first 2-3 weeks, you will not see any issues. But halfway through the treatment, the side effects will start to come and they'll start to build up. So these are the early or the acute side effects of treatment. So the severity depends on how much of these normal tissues that we treat. Actually, not everybody will get side effects. They will get these changes, but they do not show the symptoms. Okay. Yeah. So I think for radiation oncologists, I think it's important to reduce the volume of normal tissues that are treated. Okay. But the benefit is actually in the long run. Okay. For any tissue that is treated by radiation, there will be some damage to the tissue. And the body will heal itself by scarring and things like that. You repair the tissue, but you have scarring. The tissues will harden, and it takes some time. Sometimes 2, 3, 4, 5 years, and you slowly be shown on the patient itself. So, for example, if I treat the mouth and the neck, in time to come, 3 to 5 years after treatment, the skin will harden up, the muscles will harden up, and sometimes even the blood vessels will show some damage and changes. So these are the issues that we want to avoid potentially in the long run, because once this happens, the damage is not reversible. Okay. Yeah. So that is the implications of going for radiation therapy.
Okay. Thank you so much, Dr. Michael Wang. It's almost feeling like I'm listening to your classroom an explanation of the side effects of the radiation therapy.
I hope it's not too difficult for the public.
It was very nice, and I think general audience here will also be benefited as well as the whoever wants to learn more about the side effects and the mechanism and the especially the short-term and long-term nature of this thing. So regarding the radiation therapy options, you mentioned, for example, brachytherapy. That means that there are certain radiations that can be external, and there are certain radiations that can be internally given.
That's right.
Yeah. So is it completely dependent on the type of cancers? Certain type of cancers will be more responding to internal radiation compared to the external radiation. Is it that case?
Okay. So I would say that brachytherapy just means that we introduce a radiation source to the cancer itself.
Okay.
I think it is probably not related to the type of cancer, but probably the ability for us to deliver a higher dose to certain cancers without affecting the normal tissues surrounding the cancer too much.
So does it mean that the brachytherapy is probably one development that we have made to limit the side effects of radiation therapy? Is it something like that?
That as well. That's right. Yeah, that's right. So brachytherapy in actual fact is another modality of radiation treatment.
Okay.
What it involves is that it uses natural sources. You know, I probably will not go into the name of all these sources, but the most commonly used one would be cobalt sources. So it is a natural source, and it actually emits radiation, which is a short range.
Okay.
Yeah. So there are certain cancers which will benefit quite a fair bit from the use of brachytherapy. But however, it's not the only modality of treatment. Okay. For example, in prostate cancer, besides your X-ray treatment, besides proton therapy, we can actually also use brachytherapy for the treatment of prostate cancers. So we can actually insert radioactive seeds, the small little seeds, into the prostate itself. And these seeds will release radiation within the prostate and a little bit outside. So you, in a very well done procedure, you find very little dose to the bladder and to the rectum itself. Yeah, and it will treat the cancer equally well.
Okay.
So that's one situation. Yeah. I think in many countries, brachytherapy has been used quite a fair bit for cervical cancers. It is used primarily to deliver a higher dose to the tumor itself, beyond what conventional radiation can go to. This is because if we give conventional radiation to cervical cancers or to the potential areas of spread, there is a limit to the dose that we can give. And this limit is usually due to the dose that the bowel, for example, the intestines can receive. You know. So for cervical cancers, we know that a higher dose is needed to treat, to cure, or to control the cancer. So, and it's to specific areas in the cervix. And this can be further, the dose can be further increased using brachytherapy. So as such, cervical, in the treatment of cervical cancers, brachytherapy is very frequently used.
Okay. Thank you so much, Dr. Michael. We'll take another short break and we'll come back to you.
Thank you.
দর্শক, আমরা সুরক্ষায় প্রতিদিনে কথা বলছি রেডিয়েশন থেরাপি প্রসঙ্গে। আমরা অনেকগুলো বিষয় কিন্তু এখন আলাপ করলাম। তার মধ্যে ছিল রেডিয়েশন থেরাপির সাইড ইফেক্ট অথবা এর পার্শ্ব প্রতিক্রিয়া, যেটা অনেক সময় আমরা রেডিয়েশন থেরাপি শুনলেই ভাবি যে এর বুঝি অনেক রকম সাইড ইফেক্ট থাকবে, কিন্তু ডক্টর মাইকেল ওয়াং যেটা বললেন, আধুনিক যেই ব্যবস্থা দিয়ে এখন এসছে সেখানে কিন্তু পার্শ্ব প্রতিক্রিয়া অনেকখানি কমে এসেছে। এবং তিনি খুব মজার একটি তথ্য দিলেন যে অনেক আগে যখন রেডিয়েশন থেরাপি ব্যবহার করা হতো, সেই সময়টায় সাধারণত একেবারেই শেষের দিকে যারা চলে এসছেন এই ক্যান্সার রোগের, তাদেরকে রেডিয়েশন থেরাপি দেওয়া হতো। ফলে এই রেডিয়েশন থেরাপির পরবর্তী ফলাফল অত বেশি আশাব্যঞ্জক থাকতো না। সেই নেতিবাচকতা এখনও আমরা এই থেরাপির সাথে বহন করে চলছি। আদারওয়াইজ এই সময়ের যে প্রযুক্তি আছে সেগুলো যদি বিবেচনা করি, তাহলে রেডিয়েশন থেরাপি কিন্তু অনেক এগিয়েছে এবং অনেক ক্যান্সার আছে যেখানে সে রেডিয়েশন থেরাপি খুব সাকসেসফুলি ক্যান্সারকে আমাদের শরীর থেকে নির্মূলে সহায়তা করতে পারে। ডক্টর মাইকেল ওয়াং, at one point he mentioned about proton therapy, and it's a word that's buzzing around the world, and especially in our country, people are also talking about proton therapy, and some people are considering it's way better option than the existing radiation therapy we have. What's proton therapy, and does it actually give much better outcome if we consider other radiation therapy options we have.
Yes, okay. So proton therapy is very close to my heart because we actually started this journey more than 10 years ago.
Okay.
And at the National Cancer Center, we just started treating our first few patients with proton therapy. So proton therapy is actually a subatomic particle. It's a hydrogen atom with a positive charge. So when a proton particle is used to treat patients, the beams will enter the body at a very low dose, and it's programmed to release its energy at the site of the tumor. So surrounding the cancer itself, there is very little radiation. So in a sense, if you look at the dose that is given out by the proton treatment itself, the dose to the surrounding tissues are actually very minimal.
So less side effects.
So it reduces the side effects.
Okay.
And because we can target the radiation to the tumor itself, you can actually increase the dose to the tumor and hence also increase the control and the cure rates.
Okay.
Proton therapy is actually very useful for certain tumors, especially those which are very deep-seated, or those tumors which are very close to a very important structure. Okay. And I think lastly, many centers use proton therapy to treat children. Okay, because in children, their organs and their tissues are still growing. Any form of radiation will actually disturb or disrupt the growth in children. So in Singapore, there are certain indications which we are given or allowed to treat with proton therapy, and a vast majority of these cancers that we can treat with proton therapy are cancers in children and young adults.
Okay, interesting. So does it mean that it's not always the case that the patient wants to go for proton therapy, but for example, as a clinician or a oncologist, you think that proton therapy and, for example, X-ray or other radiation therapy will give same benefit. So you probably will suggest the conventional or the other options that we have compared to the proton therapy, or if the patients can bear the cost, they can also actually go for proton therapy.
I mean, for Singapore itself, as I mentioned, the use of proton therapy is highly regulated.
Highly regulated.
Yes,
so not everyone can get access
not
to
everyone
it.
can get proton. Not everyone can get. Not everyone can get proton treatment. There is a cost to it.
Okay.
I think largely the reason why not every patient can get proton therapy is because in a certain sense, the use of proton therapy for certain cancers is not cost effective.
Okay, so that's the thing. So the reason
right.
I'm asking it, because a lot of people may think that, well, this is just less side effect and some other added benefits, so why not we're going for this? And,
that's right.
and there is a misconception about this, that
that's right.
some people will consider proton therapy as a magic bullet, that this is the cure for probably all type of
that's
cancers.
Right.
That's not the case, actually.
That's not the case. So if you look at the history of proton therapy, I think it was discovered it was used to treat patients right from the 1950s. So it has been in use for at least more than 70 years.
Okay, so it's not completely new therapy that we are talking about.
Correct, yeah. But if you look at the first hospital providing proton therapy, that's only way back in 1991, and it's in the US. So if you look at the machinery that is required to produce proton, these are very big structures. Probably, entire setup can cost you millions of dollars, and you need a big infrastructure. And as a result, translating the cost to patients, proton therapy is just not cheap. It's very expensive.
But in your opinion, do you think that if there was enough technological advancements and lots of investment to make this technology more affordable and more accessible, do you think that proton therapy will actually give better outcome compared to even considering brachytherapy or other radiation therapy options we have for all sorts of cancer? Do you think that will be beneficial?
I would say I think the future is very promising.
Okay.
I think, as mentioned just now, because proton therapy is expensive, and in the US, I think most patients who go for proton therapy have insurance in some manner.
Okay.
And it is also very difficult for a proton therapy center to conduct trials comparing proton therapy and conventional X-ray therapy. So we do have quite a good range of results coming out from proton centers, and from there you can see that in many of these studies, although they are not big studies, there is improvement in the side effects. There are fewer side effects. Okay. I think in terms of cure rates or survival, we don't see that data yet.
Okay.
Because I think many patients are self-selected to go for proton therapy.
Okay.
In terms of technological advancements, technological advancements for proton is a little bit slower. This is also because after 1991, many more hospitals have come to join in the proton race, but this increment has been quite slow. Okay. Only from the middle 2000s, we started to see more proton centers coming out. And I think in the next 3 to 5 years, there will probably be slightly over 100 proton centers in the world. But this number is very small compared to the other the radiotherapy centers worldwide.
Yeah.
So in terms of doing trials and research studies to compare the two, although there are many more trials coming up, we have yet to see the results yet. In terms of technological advancements, there are a few vendors which actually supply all this equipment. And we can see that in terms of technology advancement, it is following that of X-ray treatment. So for example, the latest in the treatment delivery of proton beams, it's something we call a pencil beam delivery, meaning a small little spot of up to 2 to 3 millimeters is actually shot into the cancer itself. And these spots can be used as a scan to treat the different layers of the cancer. This is called pencil beam scanning. Okay. It is just like a dot matrix printing, So this will further spare the normal tissues from radiation. So that is one big advancement. The other big advancements are faster dose delivery to the cancers itself. We are also looking at technology where we are able to track cancers that actually move. Okay. When you breathe and things like lung cancers or cancers of the prostate, which actually move a little bit when there's gas or when there's urine. So there are ways to sort of track and to follow these tumors so that the proton beam can be more precisely delivered. Okay. So there's still a long way to go,
But there's some promising.
Yes, but there's a lot of promise.
It's a promise. Thank you so much, Dr. Michael Wang. We're really at the end of the program.
Thank you.
The last question will be: you were at National Cancer Center, Singapore. There are lots of advancements that's going there, and also in Bangladesh, Bangladesh is also making progress regarding cancer treatment. What are the possible collaboration options that you see between Bangladesh, the hospitals here, and also and hospitals in Singapore, where we both can be benefited for understanding of cancers and also for the treatment outcomes?
Yes. Yeah. That's right. So I think in terms of collaboration, the cancer journey actually involves a very complex and a very tedious pathway. Right from the beginning, cancer prevention, screening, early detection, and then treatment, and clinical trials and things like that. So I think in every step of the journey, there is an opportunity to collaborate. We have many programs at the National Cancer Center itself. We have a large number of clinician scientists and even researchers, and we also have, ready infrastructure in the new cancer center itself for translational cell therapy research. So in terms of collaboration, I think we can look at training expertise, certainly with drug development, early detection with liquid biopsies, gene studies, of course, because I think a lot of cancers are due to changes in the gene profile of the body. And in terms of cancer prevention, I think just looking at our lifestyle these days, a lot of cancers are due to smoking, drinking, unhealthy lifestyle, obesity, and sometimes even air pollution.
Yeah, that's true.
So I think we have various programs of this sort. Of course, understandably, I think between the different populations, the risk profile and the demographics is a little bit different. But I think, this is very important for expansion of knowledge for both sides as well.
Yeah.
Certainly a lot of opportunities to collaborate.
Opportunities here. Thank you so much, Dr. Michael Wang, for giving us time, and we really look forward to see you again here in Bangladesh, and looking forward to some of the productive collaborations that we can have.
Thank you. Yeah, it's a great pleasure to be here.
Thank you so much. দর্শক, শেষ করছি আজকের সুরক্ষায় প্রতিদিন। আমরা কথা বলছিলাম রেডিয়েশন থেরাপির প্রয়োগ ক্যান্সার চিকিৎসায়। আমরা ডক্টর মাইকেল ওয়াং, যিনি সিঙ্গাপুরে চিকিৎসা দিচ্ছেন, তার কাছ থেকে অনেকগুলো নতুন তথ্য শুনলাম, এবং সিঙ্গাপুরে কীভাবে ক্যান্সার চিকিৎসা দেওয়া হয়, শেষ পর্যন্ত প্রোটন থেরাপির যেই ব্যবহার সেটা সেখানে কতখানি করা হচ্ছে, তার নিজের অভিজ্ঞতার আলোকে এবং তার এক্সপার্টিজ যেটা আছে তার আলোকে কিন্তু তিনি আমাদেরকে এখনকার প্রযুক্তি এবং সামনে কি হতে যাচ্ছে সে সম্বন্ধে ধারণা দিলেন। একই সাথে তিনি এটাও বললেন যে বাংলাদেশের সাথে সিঙ্গাপুরের কিন্তু ক্যান্সার গবেষণায় নানান ক্ষেত্রে কোলাবোরেশনের সুযোগ আছে। আমরা চাইব যে আমাদের দেশের যারা চিকিৎসক আছেন, যারা গবেষক আছেন, তাদের সাথে সিঙ্গাপুরের একটি ভালো গবেষণামূলক সম্পর্ক বা কোলাবোরেশন তৈরি হোক, এবং ক্যান্সার চিকিৎসায় আমরা একসাথে এগিয়ে যাই। সেই আশাবাদ রেখে আজকের মতো শেষ করছি সুরক্ষা।